Today I'm going to tell you about a case of chronic child abuse of a child with imperforate anus for 12 years. As you all know, child abuse is a commonly discussed and a frequently encountered topic, and it's usually a global phenomenon. The story I'm going to tell you about is about a child who had a surgical condition which led him to have 12 years of undetected child abuse. And the special thing about this case is that so far we could not find any literature regarding such a case. And I would like to raise the question, are we responsible for the child abuse inflicted upon this child? So as the story starts, a baby boy who had antenatal history of polyhydramnios and fetal growth restriction was diagnosed with imperforate anus at birth. So he was transferred to a tertiary care hospital where they had done defunctioning colostomy surgery, and the reconstruction surgery was postponed until the child was fit for the surgery. That means until he was 1 month of age. So the parents were informed regarding this condition, and they were given a date for the surgery and put under clinic follow-up. But what happened was, the mother of the child had gone abroad to support their financial status, and the father had abandoned the child, and the child was left with the grandmother to be taken care of. So you can imagine this as a child with abnormal behavior and without the midline laparatory scar and the colostomy bag. So what happened was, the caregiver had utilized his surgical condition as a means of earning money. She had actually removed the colostomy bag and allowed the fecal matter to come outside from the abdomen, through the abdominal wall, and had taken the child from door to door, avoiding public places, claiming that this is actually a very rare medical condition which cannot be cured, and to cure it also that she needs a lot of money. She had deliberately avoided public places because of the unwanted attention that she will be getting. And she has also given the child to other people to again for the begging purposes, and sometimes these people had taken the child without even informing the grandmother. This child was not sent to school or given any kind of education, and he was given bribes for these activities, so the child was actually happy engaging in these kind of begging behaviors. So this has persisted for 12 years. When one day the grandmother had noticed that a pinkish lump was appearing in the abdomen, especially in the colostomy side, and the child had a distended abdomen, and the child was also crying in pain. She had taken the child to a district hospital where again they had diagnosed the child to be having acute intestinal obstruction due to an irreducible prolapsed colostomy site, and the child was transferred to a tertiary care hospital. An emergency laparotomy, exploratory laparotomy surgery was done, and later on, once the acute condition was settled, the anal and rectal reconstruction surgery was performed. So as you can see, this is the imperforate anus of a 12-year-old, and the midline laparotomy scar, and also the colostomy. They have suspected child abuse in the tertiary care hospital and have done several referrals. In the medical legal referral, they have detected that the child did not have any injuries suspecting of physical or sexual abuse. And the psychiatric referral was done because the child had shown inappropriate behavior for his age and a little bit of hyperactiveness. And they have diagnosed the child to be having a low IQ level and ADHD. The radiological studies have detected no bone lesions suggesting of physical child abuse. The STD screening was negative. The pediatric referral had no evidence of nutritional deficiencies, but the child was not given any kind of immunization throughout this period, except for the BCG vaccine which was given at birth. So to manage this this child, there was a case conference, including forensic experts, pediatric surgeons, child psychiatrists, social services, child probation officers, parents and the guardian. And their final decision was to institutionalize the child with regular visits of the next of kin. He was also to be given the basic education and later on was sent for vocational training in carpentry and motor mechanics. So later on follow-up of the study, this is what we saw. As you can see, there is a drastic change in his behavior from the abnormal behavior that we saw earlier. And also he is being homeschooled. Now he can read, he can write, and he can do a lot of other things from compared to the state that he was. And the caregivers are actually considering giving him higher education once he completed his basic education. He is allowed to sit for the grade 5 scholarship exam after special request from the government. And also, in literature, it is said that once you do a rectal and anal reconstruction surgery in an non-infant child, it is very difficult for them to again get the reflexes and the normal bowel habits because of the sphincter dysfunctions. But surprisingly, this child did not have any kind of such complication. There was no bowel irregularities, no soiling, nothing, and he was not on any kind of dietary modifications as well. So because of this, the specialists have asked him to not to continue the surgical and medical follow-up, and he is actually living a normal life. Now in 1999, WHO has declared a definition for child abuse. And there they have actually categorized child abuse according to 5 categories, including physical child abuse, sexual child abuse, neglect, emotional abuse, and exploitation. So here, this child faced child neglect, emotional abuse, exploitation, and abduction. According to the definitions of the subcategories, they have actually given a definition which can be to distinguish poverty from neglect. And there they have stated that it can only occur in cases where reasonable resources are available to the family or caregiver. And also in Sri Lankan Penal Code 388, 288, 350 and 360, they have stated laws against child abuse. But the problem with these laws are no one are actually aware about these kind of laws. So where did we go wrong, and how could have we prevented the 12 years of child abuse that this child had to face? The hospital and medical staff, they could have had a high degree of suspicion at birth, and usually you take the social history of the patient as well. So they could have informed the relevant authorities, or could have done a proper follow-up. And when the child did not actually present for the surgery day, no one actually cared to inquire about that as well. And the MOH area officers could have detected the child in this area, especially it's the duty of the public health midwife, and also non-governmental organizations and social services. And again, as I stated, though there are laws, no one is actually aware of those. And then you have the parents and the guardian. Though in Sri Lanka, the healthcare services are free, they have additional charges of transportation, food, so the parents might have actually problem with dealing that kind of thing. And also because of their educational status, they might be unaware of the consequences of the thing. And also they might have the fear of that if they actually inform regarding this condition, it might disrupt their livelihood. And if they later on even they wanted to inform regarding this condition, they might have not wanted the unwanted questions that the medical professionals will be asking them. And if this child was actually not from a poor social background, would have the story gone in a different direction than this. And also the society. How many beggars and children are we seeing on the roads, and how many of us actually care to inform some kind of authority regarding this condition? So what I like to recommend is that as medical professionals, we should have a high degree of suspicion and detect these kind of high-risk children at birth and establish a proper follow-up care so that they won't have to face any psychological, sexual or physical trauma and have an actual normal childhood in growing up. So these are my references. Thank you very much.
From which all of us can learn, at this level. Forget about this abuse part. You can deal with it. Any of the child is doing well, I will report this to the doctors who have looked up. But please remember that this doing temporary colostomy and discharging is highly into or sending child home and not looking after that child. I don't know how to describe that. It's barbaric, I would like to say. And I have worked in a very active colostomy club. There are colostomy functions. These children, they take all the details, including the Wickramasinghe area and telephone calls, nearby police and all, because it is a crime, this is the learning part of it. So don't put the blame on the father and the ignorant other people. This is basically, I'm not trying to control the people. And being a specialized unit, highly specialized unit, where a child was sent and colostomy was undertaken and the condition was diagnosed, they know very well this imperforate illness cannot be left alone like that. So the basic problem is there, that particular unit, alright? I don't know, but I think it's a good thing that you have highlighted this problem. It's a good lesson for all of us. Thank you very much.
I must say I am the one who reviewed this paper, and although it's usually our practice not to accept case reports for conferences like this, I have absolutely no hesitation in accepting your abstract. And I'm extremely happy that I did so, because I think it has laid eyes open to so many people about this problem. And you, I must say, you presented it very comprehensively, including analyzing where it went wrong. First of all, I would like to know the unit in which the final corrective surgery was done. Where was it done? Right. I fully agree with Professor. You see, when you care in a tertiary center for people with serious disease, it is your duty to ensure their health. This is, I can tell you as far as about 30 years ago, when we were doing what's called the rheumatic fever prophylactic clinic, as a registrar in the Vadysinghe board, we had the monthly thing. We marked the record and we know the people who are supposed to come for the monthly injection on that day. If they don't turn up for the monthly injection, we used to immediately send a postcard saying, you have missed your monthly injection, please turn up, otherwise you might get them. That was 30 years ago, or nearly 40 years ago, I would say. That now, when you, as you say, when you discharge a child from your unit with a colostomy, not to have followed up and found out what happened to that child, I think is almost criminal negligence. I won't want to go further. I think that is my comment about it. And also, the MOH and PHM, you have really highlighted that. I mean, it is absurd. How is that a person could live in this area and the PHM not come to know that such a thing was going on? We are so proudly talking about our health services. This kind of patient brings all of us to shame.
In that defense, I'd like to say that the child is actually taken from one MOH area to another MOH area. So they might not actually have that kind of thing going on because they don't have a specific place to live.
The post-socioeconomic background, they don't have a proper addresses, and that's what I think really that was happened. They tried to trace this one because the surgeon couldn't trace the victim.
This is of course part of it, so that there was no link, and now of course with all the price and then they have a education system. So this may be the explanation, but I think still somewhere it is surprising that no language of the DHL picked up this chat. Anyhow,
Thank you.
One more question, at least I think I would like to perhaps direct this question even to Professor Arnasolia. That is a completely different area which I'd like to focus on. That is the use of children or exploitation of children for the purpose of begging. And this is something that I think all of us see in the city of Colombo. And I think very little is being done about it. And we also tend to perhaps encourage this kind of thing. That is because we feel sorry to see the children, mothers with children. And I think if people go into the purpose is done very deliberately, use children for begging. I think when I was a medical student with you, sir, we came across a mother whose purpose of having the child in a neglected state was simply for the purpose of begging. And I think the state mechanisms are not doing enough to prevent this practice.
It's better to not be correct. I can tell you what I do when I see that. I immediately tell the mother, you're doing something, and I even pretend that I'm going to phone the police now. Like when I do that, I tell her, if I ever see you around here, you will be in jail next time. Right, okay? But I might give 50 rupees after that. Okay. But I really scare them. I think more people have to do that. More people have to do that, because especially when they see a child being that is the message of people. Society has to get knowledgeable about this. Actually, it's a criminal offense. I prove the threat I give to her, I can really carry out, because I have the NCPA number with me. If I ring and say so and so is here, how to send the person to catch and incarcerate that mother and punish them. So we must be aware of that and use it. Thank you.
These reports have to go to the police or to the NCPA?
NCPA, because they have a special police desk there. So they'll be quicker. If you inform the local police, the reaction can be somewhat lukewarm. Unless you I suppose you say, if I ring and say I am so and so, they will probably react. But generally, anyone can ring NCPA and give the exact details, and they will